Are you in every way, woman?
We're back with the doctors of wrestling discussing treatments, and I want to make sure we're clear on all of our options. Many people will opt out of the typical medical treatments and go for the holistic approach. What do you think about that? Silence.
Well,
Dr.
we've seen a lot of patients that have done that, and what we think is, yes, holistic is great. If you want to exercise and proper diet, that's usually not the way they're thinking something alternative to chemotherapy.
Well, I know a lot of women who then became vegan and are trying to heal their bodies with food.
Yeah. But if it should be all part of an overall proper medical plan, and to delay specific treatment because you think these alternatives are going to buy you time is extremely dangerous. I had one woman that came to me that was a minister, and she was scheduled for surgery, and she called me up and was going to cancel it and said God told her not to proceed with her surgery. And so I said, didn't God send you to me?
Seriously, how do you respond to something like that?
But I told her I would follow her, but I wanted her to sign a consent that said her 2 daughters might grow up without a mother. And if she would sign that consent, I would follow her and she could do what she wanted, but I would check her breasts to make sure. We buried her 2 years later.
That's an interesting point you bring up, because obviously this issue is one that not just affects the patient very heavily, but oftentimes they have to bring their family into this process. Mm-hmm. How do you help these patients, get through this treatment and prepare their family for what's getting ready to come?
What did you say to her daughters?
Well, her husband was also a minister, and I had a private talk with him saying I'm really very uncomfortable about this. And he said, you're not going to change her mind. And I said, he was appreciative that I followed. She did come in for follow-up.
The treatment requires the whole family be involved, or whatever the support system for the patient is, whether it's family or friends, a neighbor. You want to get everybody involved and get them on board. And
how do you get them on board and prepare them for this kind of almost change in lifestyle?
I think you have to get them on board from the very beginning. When you are actually diagnosed with this disease, you don't hide it from the kids. If they're very small kids, you then start to explain things in a simplified manner about mommy being sick, but we're going to take care of her. She's going to go through treatment. She may lose her hair. Mommy may look different. But I believe going into, that history of hiding information from family members and thinking that you can actually deal with it on your own is not efficient and good. The family is important.
Keep them from being scared.
Well, I think there's really great resources out there, too. There's a group called Kids Connected in Orange County that is amazing. They actually meet weekly, and they actually have support groups for different age levels, because different age levels can process this information differently. They have written material, publications to kind of help the kids actually process that. One of my patient's daughter wrote a book about the changes, the physical changes mom would undergo, my cancer mommy, and how she would lose her hair, but she's still her mommy. And after she's better, things are going to, go back to the way they were before.
So just like Dr. Paris was saying, the approach for treatment is from the beginning with everybody if you can. Including everybody in your treatment decisions, including everybody in understanding what you're going to go through, whether you want to try this holistic approach or whether you're going to go through with chemotherapy.
And what about the romantic partner? Because it's easy to talk to kids about, we've got these great resources. Mommy's going to lose her hair. Mommy's going to do this. What about, the side effects and how it affects the relationship with the romantic partner? Is there an element of sexual dysfunction? How do you get the partner prepared for that?
That's a great question, and I would say in probably over 50% of patients there is an element of sexual dysfunction that has been for a long time tabooed and not talked about. Because a lot of the treatments we give long-term, some of these anti-estrogen medications cause a lot of symptoms that make intercourse painful for women.
And is that something that's in effect for the duration of the treatment, or is that something that's long-lasting?
Well, once the treatment stops, these symptoms can get better, but sometimes the symptoms are just related to the menopause that was caused by the treatment, too. So some of them are long-lasting, but there are non-hormonal agents to help with things like vaginal dryness. And we actually do a lot of coaxing, and we give samples out in our office of different products, and we find some people like certain products, some people like other products. But another issue is bringing the spouse in and getting them into a support group, so that a lot of times they're afraid to hurt the patient. You know, the patient becomes much more vulnerable, and they look at them as something that can be broken now. And so it's really kind of re-educating them that it's the same person as before, they're just a little different.
Well,
But
and don't you think that frustrates the patient?
absolutely.
I mean, if that were me, I would never want somebody to see that as a weakness, or me being vulnerable because I have a sickness or an injury, for that matter.
But your spouse is supposed to see beyond that. And so that's why the counseling is not for you alone, it's for both of you together. You're supposed to, function as a unit, and your unit should become stronger, but as Dr. Kersey and I were talking about earlier, it depends on where that unit was before the diagnosis. Because, there are some marriages where there's dysfunction there, and once you have this diagnosis, the two partners may drift apart.
Yeah, I mean, spouses will have differing opinions on what to do just with the breast and the surgery for the breast. The woman might want to remove both her breasts. The spouse might say, don't do that, please.
Do you find that men are more attached to their breasts than the women are?
No,
Sometimes.
It varies.
Yeah,
Sometimes.
Yeah, it
Sometimes.
varies.
But we sometimes make the men really happy because the wife at 45 or 50, the breasts have lost their shape, do a lumpectomy, big roast breast, and we can't keep their tops on. And they are proud. And that's a great feeling. I wasn't going to do this work because of radical mastectomy, saying I won't do that when I'm in practice. And now it's one of the best things I do. I have the happiest patients, and it's a remarkable turnaround.
So we can definitely give the benefit, and not just the negative side effects there.
That's very true.
But I think a lot does depend on where their relationship is when they come into the cancer diagnosis. I mean, it really does make a big difference.
Well, it's just so interesting to hear all the aspects in the holistic approach and the relationship approach, and we appreciate that BreastLink is all-encompassing and so comprehensive in treating the patient. So thank you for that, doctors. We'll be back more every way. Stay tuned.